So I thought it'd be really nice to pass the question back first to Chi, because she's our MP and she's in Parliament and we'll see the big picture perspective, to get her feedback on, what should the Newcastle be doing in terms of test and trace? And are we working enough with the universities and the laboratories as well? And what are your key concerns, Chi?
Alison, thank you so much for that. And it's through the 6, 7, 8 months of the COVID pandemic now, it has been so hard I think for most people to access truly objective reasons, explanations of how the test and trace system should be working. And unfortunately, our government has not been providing that. There's been a lot of spin, and this is just too important an area to spin about. So I'm not going to, I think just to say that the key mistake made very early on in February or March was not to go to local authorities and use the public health system already in place there, and also not to engage enough with local universities. And what the government has done is mainly to put out contracts to private sector providers to set up labs, centralized labs, so that they can control it, even though controlling a bad system is not what you want to do. Whereas there was, as Iram said excellently, there was public health test and trace experts in every local authority, in Newcastle City, council, and then the universities, Newcastle University, and local hospitals like Gateshead Hospital. I've had back and forth with them because they've had test facilities being unused as people are struggling to get tests locally. And I think I'm hoping that government is learning. And we are going to see, we're certainly staying in the private sector, but we are going to see more integration on the ground with local capability and giving local resources to local authorities to do that. But I'll just add, that I am concerned that there's more and more of a message of it's people's fault. It's people's fault for going out. People's fault for asking for too many tests. People's fault for not getting tested enough. And that is going to prevent us from really dealing locally. And we see in Newcastle the rising numbers, which are very scary, and we need to deal with that locally in a way that has public confidence.
Great, Chi, thank you so much for that overview. Jamie, and then Iram, just add to it, don't repeat if you don't mind, because we've got lots more questions.
It's worth noting that 10 billion has been spent on this track and trace system, privatised. There was summed up by a report that they've got 25,000 people on the contact tracing, and they've got, and I've got the number here somewhere, they've found 51,524 contacts in 2 months. That's one contact per month per employee. They have, the people on this, not their fault, they've got a WhatsApp group called the Mouse Movers Club, where they remind each other to move their computer mouse every 15 minutes so they don't get locked out of the system. This should never have happened. If you compare that to the 300 million that's gone to local authorities, who have a 99% success rate in tracing contacts. Now, I don't have any management or leadership of this comes through the local authorities, but our local authorities are coming together and trying to operate on a regional basis, and it needs government, again, actually, to allow them to fund the job properly. Simple as that.
Thank you. Iram, would you like to add anything?
Yeah, just to add that, I mean, the difficulty, I guess, for local authorities is that, or from my perspective, is that the everything to do with COVID is kind of instructed by the government. So there's not a lot of scope from my portfolio is for political leadership or political influence on that. We're simply having to roll out these schemes and programs and projects as directed to by the government. It goes without saying what my feelings on that is. She's said some of that. Inadequate and incompetent is the two words that I'll use. So we're just really just responding the best way that we can in terms of our work with universities and how we're kind of being told to do that. Jamie's just touched on the track and trace system that they gave to the private sector appalling, especially in consideration of how much time the government has had to plan this, and then completely failed on it. It is one of the most important things that we need in this country globally, to be able to try and control the spread of that and to find out where the support really needs to be. So absolute lack of failure from the government, and unfortunately we're experiencing that with our residents and ourselves.
So, and I'll just add, Iram, you're absolutely right. The privatised system, Serco and Cital, are going to get around £700 million. And that's about 8 times the budget that Public Health England has for a year for communicable diseases. That's for everything, not just track and trace. And as Jamie and she said, they've been disastrous. It's not been effective at all. And they are reaching fewer than 60% of the contacts, whereas the local authorities and local public health protection teams are reaching over 90%. And the local authorities have been left to do the mopping up without that £700 million, which could so easily have been given to local authorities. So we've got a long way, and the really disastrous rule of 6 is much more about the fact that we have failed with the track and trace system. And as Chi says, we're pushing it back onto everybody again, making it their responsibility rather than the government doing its job on the track and trace.